Hey guys, welcome to another presentation. This one we're going to talk about communications. We're going to talk about a couple different types of communications. We're going to start out talking about radios and that type of communication systems, and then we're going to move into interpersonal communications and how to communicate with our patients. So think about how we get called out to a scene. We have to access the system, or our patients rather have to access the system. So they have to have communication between the person who needs help and the dispatcher. This is usually done via a public telephone. It can be a public telephone, or I guess a private telephone, or it could also be from a radio from fire or police. So basically, patients access the system by calling 911. And that's just true in this country. Some countries, like over in Europe, they use 119 or 999. And sometimes in other countries, you actually have 3 different numbers if you want police, fire, or EMS. It could be 111, 112, and 113 for, police, fire, or EMS. It all depends on where you are. Fortunately, in this country, by and large, we use 911 to get access to all 3. Fire, police, and EMS. So the call comes in, and who does it go to? Well, it goes to dispatch, although there's a potential that it could go through what's called a PSAP, or a public safety answering point. For example, in Austin, they use a PSAP, and what happens actually is that the police department answers first, and they have to figure out basically fire, police, or EMS, and then they send it to the appropriate personnel, to the dispatcher. So the call gets dispatched, there is an alert sent to personnel, and the personnel are sent to the scene. There are a few ways this could happen. It could be radio paging. It could be telephone. It could be a voice over the radio. It could be via cell phone, or it could be through a mobile data transmitter, or an MDT. I'll write that out for you. Mobile data transmitter, or terminal. Alright, so let's talk about dispatch and the EMS unit. So you got the call, you're working on the ambulance, the dispatcher has sent you out to the call. How do you want to communicate? Well, first you should tell them that you're headed to the call so they know that you're going and they don't have to send anybody else. And then you let them know when you get there. You tell them you're on scene. You can ask them for special assistance or any additional help or resources. Let them know when you're going to this, or when you're leaving from the scene, and where you're going. So not just arrival at the receiving facility, but where, which one, which facility. And then when you're done delivering your patient to the hospital, you let them know over the radio that you're back in service and able to take another call. Dispatch can also potentially help you with assistance with a mechanical or navigational problem, although navigation should be something that you become familiar with as you work in whatever district you're in. So they're not too happy always to help with navigational issues, but they certainly can if something's not working properly. You can also get immediate assistance or information from police, fire, or the highway department. And dispatch is responsible for the general coordination of the units, figuring out who is the closest unit to that call, who should take it, where should they go, that sort of thing. Now I'm going to talk about the EMS or hospital physician. So one of our responsibilities on the ambulance is to let the hospital know that we're bringing in a patient. So we want to let them know fairly quickly after we get into the ambulance. When we talk on either the radio or the phone, we can actually ask to talk to a doctor or to online medical direction. We function under physicians, and there are medical directors, and doctors can provide us medical direction, or basically tell us what to do, over a phone or the radio. When you call and talk to the hospital, they do have the choice to send you to a more specialized healthcare facilities. Some of these facilities include trauma centers. Some of them also include cardiac care centers, or heart pain, like chest pain centers, or maybe a stroke facility, or pediatric hospital, so a children's hospital. There is also a way for one hospital to talk to another hospital via radio, although this isn't very common. It's more common for hospitals to talk to hospitals over the phone. Support agencies. So this can be anything from support from like police department or fire department to something like Red Cross if there's been some sort of disaster. So those are some examples of supporting agencies, and we can use some of our communication systems to talk to them sometimes. So we could actually go through dispatch. It may be that we don't have the right radio channels to talk to the police department. So we can go through dispatch to talk to them. Or it may be that we can use our radio systems to talk to directly between field units. There are other communications networks aside from the emergency communications systems. Amateur radio and citizens band, that's CB radio. There's commercial broadcast, like your FM or AM. And then there are radio systems within businesses. A lot of big warehouses will use radio systems. Some of the schools locally even use the Motorola style radio systems to communicate. Now I'm going to talk about the FCC, or the Federal, I'll write this one out, Federal Communications Commission. The FCC. So here's the thing, the FCC controls all radio communications. They are the overlord, so to speak, of all radio frequencies, and this includes everything from AM radio, FM radio, the stuff you see on TV, so TV broadcast, all of that, as well as emergency communications. We'll call that EMC, emergency communications. The FCC is responsible for allocating specific radio frequencies for use by EMS providers, and they're also responsible for providing licenses to base stations and to assigning what we call call signs. And this is really the radio frequency. The FCC also establishes licensing standards and operating specifications, and they establish limits for transmitter power output. So this becomes an issue. They basically want to kind of limit your broadcast range to what's necessary and not have you broadcasting all over the United States, for example. And they do monitor radio operations. Basically, that means they can listen in to any of your radio traffic. So there are rules for talking on the radio, things like don't use bad words. There's actually a list of words you can't say, on television, on public broadcasting television, and they get upset. The FCC gets upset, and they can actually fine you if you're using your radio inappropriately. So what is a base station? I mentioned this a base station thing. Well, a base station is a transmitter or receiver combination at a fixed location. This means it doesn't move. It is at a fixed location. It's used for dispatch, coordination of units, and possibly medical control. Geography and terrain are going to influence the installation. You want your base station to be basically up as high as possible elevation-wise, and not necessarily surrounded by any kind of mountainous type terrain. So basically a high point, and hopefully on a flat surface. So if this is your little mountain, you want your little base station to be right here. Nice flat terrain around it. It's up on top. The power output is between 42 and 275 watts, although it tends to be higher. Tends to be on the higher end of the spectrum here. So probably more like 100 to 200. There are some multi-channel bases, actually most of them are multi-channel bases this way, and they can receive on multiple channels simultaneously. So this would be like the radio in your car being able to receive, let's think of some local radio stations. You could have, I have satellite radio, but you could have like 92.5, 93.7, and 101.3, and it could basically receive all of these channels at the same time, and could theoretically play them through your speakers at the same time, although that doesn't make much sense. But when you're talking about emergency communications and you have ambulance 1 that talks on channel 1, and you have ambulance 2 that's talking on channel 2, and you only have one person to listen to all the channels, sometimes it's helpful to know that 2 ambulances are trying to talk to you at once. It can also transmit on multiple channels simultaneously. This is also very useful. Again, if you've got ambulance 1 on channel 1 and ambulance 2 on channel 2, and you need to dispatch them to the same location, you can dispatch both of the channels at the same time. You don't have to tune to channel 1 and then send them the message, and then tune to channel 2 and then send them the message. You don't have to do that. You can basically tune to channels 1 and 2 and then send the message only one time. Mobile units. So mobile, you think of mobile, you think that it moves around. And it does. These are units, they're radios that are physically mounted in vehicles. The power output is 20 to 50 watts, and the range is around 10 to 12 miles over your average terrain. It decreases in mountainous areas or in areas with large buildings, and it increases if you're on water, like in a boat, or on flat terrain. All mobiles in our local systems have multiple channel capacity, so they can basically tune to different channels. So again, it could be channel 1 or channel 2 or whatever they happen to be. It's actually more like, what am I trying to say? You have like Medcom, and you could have Firecom, and it could be Medcom 1 and Medcom 2 and Medcom 3 and Firecom 1 and 2 and 3. And you may be thinking, why do you need so many channels? Well, if you think about locally, for example, in the Bell County area, and I'm going to simplify this and draw the county as kind of a big box, and Temple's kind of right in the middle here. It may be that you have an incident working over here, and another one here, and another one here, and another one here. But you don't want the radio traffic on this incident to be confused for the radio traffic for this incident, or this one, or this one. So you have multiple different channels that you can assign to each incident. Medcom 1 is for this one, Medcom 2 is for this one, and Medcom 3 is for this one. So you can all talk on different channels without making it difficult for communications to happen. All right, now make sure you recognize the difference between a mobile unit and a portable unit. Portable makes me think I can pick it up and move it. Mobile doesn't necessarily mean that it can move around, or means that it can move around, but it doesn't necessarily mean that it's very portable. So a portable unit is when you can pick up and talk into like that. It's the one that you clip on your belt. So this is your handheld. I'm going to cross this out. It's not a walkie-talkie. It is a portable radio. Your handheld portable radio. I don't want to hear you guys using the term walkie-talkie in class because it's not. It's a portable radio. The range here, unfortunately, is limited by the low output power. The only thing powering this is a tiny little battery that's attached to the back of it. So it can only output about 1 to 5 watts, which means that the signal can't travel as far. The portable units may be single or multi-channel, though locally they're all multi-channel. Some of the ones, though, that we use in the Sim Center, I'll try and pull those out. They're actually multi-channel as well. But if you think of like kid walkie-talkies, right, the little ones that, are transformer walkie-talkies or whatever, those are single-channel radios. Now, portable units may actually be designed to retransmit through the mobile unit. Remember, that's the one on your ambulance, to increase the range. Ambulance or fire truck, I guess. So that you basically only have to be as far as or I guess you just have to stay within a certain range of your mobile unit, and it can retransmit. To get the best signal quality in theory, have the antenna perpendicular to the ground. Remember, perpendicular means that it makes a right angle with the ground. So you want your little radio here, the little antenna, to be perpendicular to the ground. The next topic I'm going to address is a repeater. And if you think about the word repeater, it starts with repeat. And repeat means that you hear something, right? If I'm going to repeat something, I hear it come in one ear, and I repeat it out of my mouth. I say the same thing. So I listen to it, and then I say it again. And that's exactly what a repeater does for a radio system. It receives the signal on one frequency, and then it sends it back out on another frequency, but at higher power. So what does this do? Well, let's imagine, here's your little ambulance, here's your repeater tower, and here's the hospital. And unfortunately, your little mobile radio on your ambulance can only broadcast this far. It can broadcast only about to the repeater, but you're trying to send the message all the way to the hospital because you have a critical patient in here. You got the lights going and the sirens going. So you are trying to call report, and basically what happens is you call your report, the radio signal transmits over to the repeater listens to it, it receives the signal on frequency 1, and then it takes and it sends that back out and it makes it louder. And then it basically sends it out to the hospital. By making it louder, what that really is doing is making it so that it can travel farther, so that you have the ability to increase your range. So the goal of repeaters is to increase radio range. Oh, here's your picture. All right. So you've got a portable radio. It hits the repeater. The repeater can send the signal out to either another repeater or maybe a base station or a dispatch center. And it can send out to even another repeater, which eventually goes out and hits your mobile unit. So repeaters are going to be strategically positioned throughout response areas to make sure that the one dispatch center, because you only really want to have one of those, can reach all of the EMS units that it needs to. So there are also satellite receivers. These are additional receivers located around an area of desired radio coverage to ensure low power mobiles and portables are always in range. So they're going to be connected to the base station or repeater by telephone lines or microwave relay. So this is just another method used to increase your range. These aren't really used much anymore, at least in our area, because they're just not needed. We have enough repeaters around that the satellite receivers aren't really necessary. The next topic is a remote console. A remote console is a control console and microphone that's connected to the base station by telephone lines. So this is a physical connection, not a through-the-air connection. Although if it's microwaves, then it is through the air. It could also be through radio waves. So it could be through the air. It allows remote locations, such as hospitals, to actually use the base station. There are some special equipment, an encoder and a decoder. An encoder encodes a message and a decoder decodes the message. There's also a mobile data terminal, and this is a kind of an old picture. They're much newer these days, but the mobile data terminal is going to be basically a computer in your ambulance or fire truck. So how do you use a radio? Well, first, know what you're going to say before you start talking. Don't waste airtime. Next, don't ever transmit without first monitoring the frequency. Otherwise, you'll end up walking over, and that's a technical term, walking over somebody else. So there may be another ambulance trying to communicate with dispatch, and if you don't listen to the frequency first, especially if you're switching back from another frequency, you'll end up walking over them. And then you want to wait a few seconds after keying up the microphone before talking. Part of this is that you sometimes have to wait for the radio to hit the repeater, so you want to start transmitting before you start talking, because there is some clipping associated with the receiver. So if you start talking here, and you talk and talk and talk, and you finish talking here, it may take a little bit before it hits the repeater, and so you actually only transmit this much of your message. When you're using the radio, be sure to identify yourself on every transmission. And that sounds silly, but everybody has what we kind of colloquially call your radio voice. Because your voice on the radio doesn't sound the same as it does in person. So even if you know somebody working up in the dispatch center, it may be that you don't sound the same on the radio, and they can't tell what you sound like. The radios tend to make people's voices sound more similar than different. You want to speak at close range, and I would say directly across the microphone. You don't have to speak directly into the microphone. Don't yell, and use your normal conversational tone and speed. I'm going to re-emphasize this part. Don't yell. You sound silly when you yell into the radio. You want to talk slowly and clearly. Again, you want to articulate what you're saying clearly, and you want to be concise. Don't be long-winded. Use proper English and avoid using codes. By codes, we're talking about like 10 codes. You've heard of, 1040 or, 1073 or something like that. These are still sometimes used with police departments if they have sensitive stuff that they're trying to talk about. But we don't use that anymore. It's much easier to use plain English because then everybody understands what we're saying. Again, have all information you need to report available before you start talking. So that includes vital signs. For example, when we talk about getting a blood pressure and heart rate, the hospitals want to know that information, but it's not helpful for you to not have that information before you start your report. When you give a radio report, you want to report the status of your patient's airway, breathing, and circulation, their ABCs, their chief complaint, and their vital signs, especially if they're not within normal limits. You want to send it early. The reason that we even call the hospital at all is to basically give them some lead time to help them prepare if there's anything they need to get ready. So the sooner we can notify them, the more time that they have to prepare the hospital for the patient we're bringing them. Use standard medical terminology, and if you haven't listened to the medical terminology lecture yet, you're going to. But use the medical terminology, and if you don't know the word, then use plain English. He has a cut on his arm. Is fine. Repeat all orders. So if you call in and talk to a doctor, and the doctor says, I want you to give aspirin, then make sure you clarify what he meant. Sir, I understood you wanted me to give aspirin, but could you confirm the dose? Oh, I wanted you to give 324 milligrams of aspirin. Okay, sir, 324 milligrams of aspirin. Thank you. So ask what the physician said, or if you think an order is incorrect, ask him or her to repeat the order. Avoid ongoing transmissions. This says stop talking every minute and assure that the receiving station is copied. But to be honest, if you're talking for longer than a minute, your report is way too long. Too long. When we do practice scenarios, you will practice giving reports, and your goal is to give your non-critical reports in less than 30 seconds, and any critical patient reports, keep them to under a minute. Use a standard format for reporting the information. Report the same way every time. I like to use age and gender, chief complaint, Some indication of vitals, so vital signs or perfusion status, level of consciousness, and then any interventions, and an ETA. But that could be as simple as Medic 1 is coming in with a 49-year-old female complaining of chest pain. Her vitals are within normal limits. She's alert and oriented. We've given her 325 milligrams of aspirin, 3 nitroglycerin tablets, and we'll be there in 5 minutes. So it doesn't have to be long-winded. It can be very simple. So when you don't use the standard format, aside from looking silly, you don't necessarily get all the information provided. Time's going to be wasted. Patient care may be delayed at the hospital. Attempts to get the needed while the hospital attempts to get the needed information, and everybody's going to be frustrated. Nurses and you and the patient, you're all going to end up frustrated. The better the picture you can paint for the receiving personnel, the better prepared they will be to receive your patient. They need to know certain things. For example, if your patient's not breathing and you're having to breathe for them, they need to know that. They need to prepare. They need to get the right personnel in there to prepare to breathe for this patient. If you had to do CPR on your patient, they need to know that too, so they can prepare for them. Remember, your job is to communicate, not to show off. So here is your patient report. Number 1, identify yourself. Service unit number, possibly personnel ID, but not always. So if I was going to a hospital that would get ambulances from lots of services, I would say which service I was from, and then, medic 13 or medic 14 or whatever medic unit I was on. Identify the patient, but no names. Age, sex, and sometimes weight. This is true for cardiac patients that are going to the cath lab. That's really the only time you give the weight, is a cardiac patient going to the cath lab. They want to know the weight there. Then you tell them what's going on. What's the cause, if there's a mechanism. So if somebody was in a car accident, for example, patient was driving a sedan-style vehicle that rolled over 6 times. And you talk about the chief complaint. The patient is complaining of back pain. Physical exam information. Again, this is going to depend on kind of where you are and whether this is normal or abnormal. If everything is fairly normal and within, what we call normal limits, it's okay to say that. And if something's outside of normal limits, that's really when I would focus in and say, hey, patient's blood pressure is high. As far as this other stuff, the pupils, skin, neurological condition, vascular signs, I wouldn't do this on my radio report to the hospital, but when I'm actually transferring patient care, that is when I would tell the nurses about the pupils, the skin, any neurological conditions, vascular signs, and then all of my pertinent findings in order from head down to their toes. And they would also get all of my vital signs at handover when I transferred care. Also given during patient care transfer to a nurse, past medical history. So this includes anything they tell you they've been diagnosed with, anything they tell you that they're allergic to, and any medications they're taking, as well as the dose. Next step, talk about the treatment. What treatment have you given? And if you're giving a report from the ambulance, anything that you've given prior to transmission, and then confirmation of any treatment that the doctors are ordering for you. When you get to the hospital, this will basically be all of the treatment. I'm going to abbreviate treatment TX, treatment. Any changes after the patient's treatment? Who's their physician, if they have a particular physician? This is actually pretty common with your OB patients. They always want to know who the patient's obstetrician is so they can send them a message. Your destination, theoretically you know your destination because that's who you're calling, but it may be that you're going to the obstetrics department. It may be that you've been told to go to the cath lab. Your ETA, or your estimated time of arrival, and that's given in minutes. So we would say ETA 5 minutes, and that would mean our estimated time of arrival is about 5 minutes. And then if you have some sort of transport code for your patient, you can include that as well. So now what do? You have multiple patients in the back of your ambulance. Maybe you went on a minor collision, but you have a few patients from that. Well, you want to number them. Patient 1. And then you give the whole report for patient 1. And then you move on to patient 2 and you give the whole report for patient 2. Present them in order from most serious to least serious. All right, so more on using the radio. Be courteous. Try not to show emotion, and do not ever, 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 ever curse or use obscene language. Do not vocalize pauses, and that means the or whatever it is. And last, don't unkey your microphone until you have finished talking. So that's it for the radio communications. I'm going to move into interpersonal communication. And that's really, you can see inter is between, and personal is people. Between people communication. This is one of those skills that I think is most underrated, and also very highly rated depending on where you go. I think we kind of take this for granted. I certainly coming out of high school and going into college thought I was great at talking to people, and looking back I was absolutely horrible. And I think it's really important to recognize that basically nobody is good at this. Everybody, no matter how long you've studied it or how long you've worked on talking to other people, nobody is good at this. So we always, always, always have room for improvement. So here's the deal. Start by making and keeping eye contact. Be confident. So confidence in yourself is going to inspire trust from the patient. How do we become confident? It's kind of hard to just be confident, right? We study, we practice, and we practice not until we're doing it right most of the time, but we practice until we can't get it wrong. We practice assessing patients, we practice vital signs. That in turn is going to turn into confidence, which is going to lead you to be more trustworthy in the eyes of the patient. Be respectful. Use proper names unless told otherwise. And if you haven't remembered to get their name, use sir, use ma'am, Mr. or Mrs. If they have a rank that you're aware of, like a captain in your organization or a commander, don't ever speak condescendingly. Hun, darling, sweetie, cutie, honey. Don't use any of those, ever. And be conscious of cultural differences. We'll talk a little bit about some cultural awareness type stuff, but recognize that people from different cultures view things very differently, and that that's okay. And sometimes they may not want medical treatment. They may have some issues with how Western medicine is practiced. Don't be offended by that, and recognize and be respectful of their culture. Again, be courteous. Please, thank you, yes ma'am, or yes sir, no ma'am, no sir. And I want to hear this in class. Everything needs to be ma'am or sir, and there definitely needs to be please and thank you. And be truthful. One thing I've found in my own life is it is so much easier to just be truthful and admit your own mistakes than it is to try and cover everything up. Just be honest with everything and be truthful. So one of the cool things that we get to learn in this class is a bunch of really cool new terminology like acute coronary syndromes. Any of you guys know what that is? The patient's family probably doesn't either, and the patient may not. Instead, when I change it around and say, you could be having a heart attack, that is something that the family understands. So use terms that the patient or family will understand. This is your responsibility to know when to use fancy words like acute coronary syndrome and when to use things like heart attack. Be careful of what you say about the patient and where you say it. This is especially true in in family, sort of tense family situations. Maybe it's a mom and daughter. Maybe the mom called about the daughter, and the daughter's, 19 years old and can make her own decisions. Just be careful about what you say about the patient and where you say it, and be very aware of your body language. Look at this guy in the picture. What do you see? I see that he has his hands on his hips. I almost feel like he's looking down at me a little bit. I feel like he doesn't necessarily care. If he were somebody coming to try and help me, I feel like he doesn't really want to be there, that he feels really impatient, or that he just doesn't want to take care of me. So be careful of your body language. Make sure to speak slowly and enunciate. I'm really bad. I speak really quickly. And I have to really focus on making sure I speak slowly enough that my patients understand me. And allow time for the patient to answer questions. Some patients need more time than others, but give them the quiet that they need to think about the answer to your question. If the patient does not speak English, use an interpreter unless you know exactly what you're trying to say. Don't attempt the language if you're unsure. There are interpretation services or even some really cool apps for like iPhones, smartphones, that are interpretation apps. The other thing you can try is use flashcards or draw pictures. Figure out something. Find some way to make it work, because you're responsible for taking care of the patient. For the hearing impaired, it could be that you need to use an interpreter for sign language. Be sure to face the patient when speaking. It allows them to see your lips, and it allows them to see your facial expressions. And honestly, facial expressions and body language are going to communicate like 80% of your message. Now, it's still going to be hard for, communicating if something hurts, or, if they're feeling sick to their stomach, or to ask, what's the last thing that you had to eat? But it can certainly let them know that you care and that you're working on a solution for them. Kids. So with kids, be sure to get on their level, approach them slowly, avoid threatening postures, and explain everything that you do. Sometimes it's helpful to, do it to mom first, or the baby, or to the baby doll, or to the toy, or whatever it is. But get on their level and explain everything that you do. It's okay to be honest with them about things that may hurt. Don't lie. Respect a child's modesty. Use the parents to help calm the child as long as the parent is calm, and this is key. Let the parent hold the child if it's not contraindicated, and allow the child to keep familiar objects like a teddy bear, or maybe a book, or a blankie. With elderly patients, use the last names of older patients until told otherwise. Mr. Smith, I see that you're having some chest pain. Don't use slang. Proper English. Don't assume senility, deafness, or infirmities. I have a tendency to be loud anyway, and I did have a few patients call me out on, why are you talking to me so loud? I'm not deaf. So don't assume that. Be aware of cultural differences, and by cultural I mean not due to the culture they come from, but because of the age. There are differences. One of the things kind of with my age group is we use the word dude a lot. Hey dude, how's it going? I don't know if that's still true of people growing up, but for me, and my peers, that's not disrespectful. But when I'm talking to someone from a different generation, it's completely disrespectful, and they're offended by that. So be aware of that. Don't rush the patient unless they're sick and don't know it. Unless they're sick, really sick. And take some time to attend to the family. If the family's standing around, be sure to talk to them if it's okay with the patient. As long as the patient gives you permission, it's allowed. But attend to them. Make sure they understand what's going on, where the patient's going. Make sure they know how to get to the hospital. So directions to hospital. And if you have a chance, get a contact number, because it happens on more frequent occasions than you'd think, that if you pick one hospital, something changes while the patient's in the back of the ambulance, and now you suddenly need to go to a different hospital. And it's really nice for you to let the family know that you've decided to change hospitals. They get really upset when they show up at one hospital and find out that their family member is not there. Well, that's it for this lecture. Please be sure to complete the quiz associated with this lecture before you come to class. And if you have any additional questions, be sure to bring them into class.